Oftentimes I'll give them a list of websites that they can go to look up information, and some of them go and look stuff up and become more educated the next time we have a conversation about their disease and have more insightful questions, and other times they don't necessarily do that. And so yes, but for sure I'll provide. I mean, today it's much, much different than it was when I first started taking care of patients in terms of information, access to information. It's a completely, practicing medicine has been transformed by the internet. No, it's more on-the-job training, interviewing patients, and we interview patients with peers there and our instructors. There isn't really a formal class. This is a communication class necessarily. It's more on-the-job training when you do your clinical rotations. Sometimes there's some role playing. It depends on what medical school you go to. So in some respects there is, or in some areas there are, some schools there are opportunities to have formal classes, but for the most part I don't think most medical schools do. At least when I went to medical school. They may now, I don't know. My opinion is that patients need to have all the information that I have. That may be, some patients don't like that. And some clinicians, as you mentioned, don't practice that way. But for me, it's my personal choice is that patients need to know everything. Some things they don't want to know. I'll ask them if they want to know about it. I'll ask them if they want to know more about it. And I'll try to guide them through the process. But I think it's most important to be transparent and forthright and provide the most accurate information that you can to patients.